Hello, my name is Kenya Soluade, and I'll be presenting on electronic health records, adoption, issues, and barriers. This is for Health Information Systems HCM 570 with Dr. Shelley Safian. Introduction. This presentation will evaluate the challenges healthcare organizations experience when implementing electronic health records. It will explain the challenges related to interoperability, usability, and health IT safety, and also describe the drivers, policies, and technical components that achieve the desired outcome. Electronic health record capabilities. What are electronic health records, EHRs? What are the importance and capabilities of electronic health records? Electronic health records assist to share data between providers and contain documentation about patient encounters that can be used for continuity of care, clinical decision making, reimbursement, legal support, medical research and education, and to monitor population health and quality management. The accuracy, completeness, and granularity of the data contents can support the delivery of safe, efficient, timely, and patient-centered care and promote better patient outcomes. EHRs are essential for reducing healthcare costs and errors and for improving patient health outcomes. It helps to identify patients appropriately to support care coordination by making patient information accessible at the point of care and supports data exchange across health information systems and other healthcare systems. They are important to improve healthcare quality, safety, and efficiency. Meaningful use and MACRA. Meaningful use is also known as the Electronic Health Record Incentives Program. It's a provision of the Health Information Technology for Economic and Clinical Health Act, also known as HITECH. HITECH outlines the plans for adopting EHRs. It established guidelines for the meaningful use of electronic medical record systems and was designed to direct providers towards adopting electronic medical records. Meaningful use allows the health and human services to establish programs to improve healthcare quality, safety, and efficiency through the promotion of health IT, electronic health records, and secure electronic health information exchange. There are three stages of meaningful use. Stage one, this stage includes a set requirements for the electronic capture of clinical data and provision of electronic copies of health information to patients. Through EHR, healthcare providers can engage with patients and their responsible party through the patient portal. Stage two, it focuses on evolving clinical processes, continuous quality improvement at the point of patient care, and the ability to exchange information in a regulated format that supports the national quality strategy. And stage three, this stage continues to focus on quality, the delivery of safe, efficient care to improve population health outcomes, and the reports created from an EHR helps to improve public health. MACRA. MACRA is the Medicare Access and Cheap Reauthorization Act of 2015. This is an incentive program that encourages health IT adoption. It includes quality payment programs, also known as QPPs, which replace the EHR incentive program. The QPPs create a new framework for rewarding clinicians who provide higher value care. In QPP, performance categories provide incentives to clinicians to use certified EHR technology. MACRA provides new tools and resources to assist providers in delivering the best possible care and changes the way Medicare rewards providers. The performance categories include the merit-based incentive payment system, MIPS, and alternative payment model, APMs. Legacy systems. Legacy systems are older technology systems that could be considered for replacement by newer technology. The new EHR systems are more user-friendly compared to the legacy EHR systems, which were like digitized versions of paper records. The new EHR systems today can collect and transmit patient data and easily access patient records to ultimately improve patient care. Effective management of legacy data is important to minimize the disruption of an EHR replacement and to ensure the transition does not jeopardize patient safety. To facilitate the transition of a new EHR system, healthcare providers should develop a plan for legacy data management strategies that focus on converting EHR data to the new systems and archiving information that cannot be converted or transferred. Electronic health records adoption barriers. There has been significant growth in the use of EHRs in healthcare settings such as hospitals, clinics, and physician offices. The adoption of EHR system improves efficiency by reducing paperwork. It improves the quality of care and prevents medical errors. It has also shown positive impact on the delivery of healthcare and the ability to reduce healthcare costs associated with medical errors and duplication of services. Some of the barriers to adoption of EHR include interoperability and the physician's perspective on EHR adoption and use. From the physician's perspective on EHR adoption and use, the barriers include the cost of adopting EHRs, finding a system that meets their needs, and productivity loss. Providers are resistant to adoption because of time burden. There is a largely unresolved tension in the healthcare community and health IT industry because between the desire to collect accurate and timely measures and the provider's resistance to entering the data into the EHR in a standard retrievable format. The lack of interoperability is a barrier that can affect the delivery of care and communication between hospitals, laboratories, pharmacies, and insurance companies. Interoperability ensures secure data sharing and exchange of electronic health information to improve clinical efficiency. It's a key factor for medical personnel to communicate and deliver safe, timely, and efficient care. Recommendations. Recommendations include implementing strategies to enhance EHR adoption and address EHR barriers. Electronic health records are used to monitor population health, support research, and quality management, as previously mentioned. Healthcare data from EHRs can be analyzed to improve patient outcomes, which require quality data content. Understanding the adoption barriers help to implement the appropriate strategies to address any EHR issues or barriers identified. In addition, implementing strategies to enable timely and efficient documentation of patient encounters is another recommendation. To enable timeliness and completeness of data in the EHR, a standardized template built around services offered by an organization, the physician's needs, and quality data content such as accuracy, accessibility, completeness, consistency, timeliness, granularity, and interoperability can support clear and time-efficient patient documentation of encounters. A standardized data entry system where providers indicate yes or no for standard questions, with the capability of including comments for more accurate documentation of key events, can eliminate some barriers with time restraints and adopting EHR. It can promote continuity of care and legal support by ensuring events are accurately documented to ensure compliance. Improving interoperability with IT systems is a recommendation to enable the effective use of technology. To improve interoperability with IT systems, the federal government intends to pursue actions to enable the effective use of technology to achieve lower cost, higher quality care, and a healthy population. In conclusion, the EHRs are used by medical professionals to support continuity of care by assisting the next provider to review documentation of patient encounters and to enable an efficient clinical decision-making process. The next provider can easily pick up from where the last provider left off by reviewing documentation. It provides accurate documentation of patient history and helps to minimize errors. This presentation evaluates the challenges healthcare organizations experience when implementing EHRs. It explains the challenges related to interoperability, usability, and health IT safety, and describes the role of EHRs in clinical decision making. It also explains the components that achieve the desired outcomes. These are the works cited for this presentation. The presentation notes for each slide can be found in the notes section, and this concludes the presentation I have prepared today. Thank you.